warm welcome to Nursing Capsule. Here we are just trying to give all the content which is needed for the nursing exam in a very concise manner. Let's go to the topic today, intercostal drainage. Intercostal drainage we have discussed in other slides that whenever there is any collection in the pleural space that needs to be drained, okay, it is being connected to intercostal drainage system. So from the word itself, it's very clear that we are just draining out the substance from the pleural space. Coming to the definition, the drainage of fluid, air, blood or chyle from the pleural space. That is what is called intercostal drainage. What are the indications for intercostal drainage? First comes pneumothorax, that is air in the pleural space, chemothorax, that is blood in the pleural space, chylothorax, that is lymphatic fluid, emphysema is pus, pleural effusion is the fluid collection in the thoracic space. Then comes lungs and heart surgery like CABG, coronary artery bypass graft, heart valves, lobectomy and thoracotomy. So these are some of the indications which we just go ahead with the intercostal drainage. What are the contraindications? In what are the cases which we cannot do the intercostal drainage? That is severe pleural adhesion. We know that this pleural layer and the visceral layer, it is getting attached together. Okay, so in that case we cannot do this one. Bleeding disorder, of course, contraindicated. Then diaphragmatic hernia. Okay, any hernia in the diaphragmatic or thoracic space, we cannot go ahead with this one. Site for the insertion of the intercostal drainage, it depends upon what substance is present in the pleural space. If it's an air, we know that air will be floating in the lungs. Okay, it will not be at the lower side. It will be on the upper side, what is called the space of the apex of the lungs. Okay, so usually if it's air, the site is second intercostal space in the mid-clavicular line. If it's fluid, either it can be 7th or 8th, 5th or 6th. Again, different books give different options, but we have to confirm with the doctors and they will be the one to decide where they have to do the puncture depending upon the how much fluid is being there in the lung cavity. Okay, yeah, here you have to keep in mind it will be in the mid-axillary line. If it's in the air, second intercostal space in the mid-clavicular line, and if it's fluid, it will be in the mid-axillary line. Either it can be 7th or 8th, 5th or 6th, like that, it varies. Coming upon the principles of intercostal drainage, there are three main principles, which is gravity. Because of that reason, we are keeping this apparatus below the chest level. Okay, so because of the gravity pressure, the fluid will be drained from the space. Then comes the positive pressure. We need to create positive pressure, so then only the fluid will be drained. Then comes the suction. Sometimes, even with this positive pressure, gravity and all, it's not draining out properly. So we need to give some extra force, that is a suction. And the suctions, usually the pressure which is applied is 10 to 20 mm of Hg. What are the types of intercostal drainage? That is, in the olden days, they used to do Hemlich valve. It's a single valve which works with the principle, once it's negative pressure in the lungs, in this pleural space, it will be closed. Once the positive pressure starts to build up, this valve will open in such a way that this substance in the pleural space can be drained out. Then 1 bottle, 2 bottle and 3 bottle. 1 bottle is just an apparatus which helps to drain the substance from the pleural space. 2 bottle is like, two things will be there, like, one is like the collection bottle and the second one is water chamber. And the third bottle is, like a collection bottle, water chamber and then the suction chamber. So these are the three main. Mostly nowadays, in the hospital, we are just using this 3 bottle apparatus for draining out the fluid from the intercostal space, that is the pleural cavity. Intercostal drainage has three major chambers. One is like collection chamber, water seal chamber and suction chamber. So there are a lot of questions related with this one. So please, just try to understand. Once you understand the basic point, it's very easy. In the collection chamber, what are the few things which we have to keep in mind is the collection, the drainage should not be bright red. It can be dark red. If it's dark red, what we have to do is we just need to notify. But if you see that it's bright red collection is there, we need to notify to the doctor then and there early. And the fluid drainage or the collection should not be more than 100 ml per hour. Then comes the first 8 hours monitoring has to be done. Every hour the monitoring has to be done for first 8 hours. Then the interval will be increase as per the doctor's instruction. Then comes the water seal chamber. Okay, so here you can just see that water seal chamber. In water seal chamber, tidalling will happen. Tidalling means in the water seal the rise and fall of the water happens. Okay, continuously the rise and fall of the this one happens. Okay, the questions comes like when the tidalling can stop, what can you expect? When the tidalling stops, there are two things. Either there is a blockage, okay, in that case tidalling can happen, or the chest has re-expanded fully, okay, in that case also tidalling can stop. Then no continuous bubbling. In the water seal, there is no continuous bubbling. Intermittent bubbling is okay. This intermittent bubbling also happens if it's pneumothorax. The air which is being trapped in the lung can escape in between. So that is what is called intermittent bubbling may happen, but no continuous bubbling. But when it comes to the suction, okay, continuous gentle bubbling is okay, but no vigorous bubbling. Okay, clear with that one? In the suction chamber, gentle continuous bubbling is okay, but in the water seal there is no bubbling, only vidalling should happen. And then but in the water seal chamber again intermittent bubbling is okay. Intermittent bubbling happens because of pneumothorax. Clear? Okay, then comes to the nursing consideration. When we insert the intercostal drainage, in the space where we are inserting, subcutaneous emphysema can happen. Okay, so like we can see that it's reddish, and when you palpate like crispy appearance will be there. It's quite normal. What we have to do is we have to mark the area and we need to watch for it's not increasing. So if it's increasing, it's not a good sign that we need to notify to the doctor. Then comes like any disconnection or damage to the apparatus. Okay, maybe somebody have kicked or the apparatus fall down, all those things what we have to do. If the tube is coming from the patient chest, what we have to do, suddenly we have to ask the patient to cough and exhale. Okay, like that. Okay, so by coughing, okay, it prevents the entry of air into the lungs. So that is one of the main purpose, and we have to make sure that the distilled water is available always at the bedside. We need to immerse the end of the intercostal drainage tube to the water, which is 2 cm under the water. Then we have to apply the dressing. The dressing also is very important. We need to keep in mind that Vaseline gauze or petroleum gauze dressing can be applied, but it's only 3-sided. It should be taped. The 4-side should not be taped, because the reason is when it's inhaling, okay, like that, because of this pressure, this one inhaling, okay, upward pressure, that the dressing will be fully closed in the area. But when it's exhaling, the air need to be escaped. So that is the reason one side should be open, which helps in the the air particle to escape from the lungs. Okay, so that is the reason it's 3-sided tape only should be used. It should be Vaseline gauze or paraffin gauze also can be used, and it's non-porous. Okay, so that is the thing what you have to understand about the dressing. Then never do milking or and clamping also, because premature clamping, it will leads to the development of pneumothorax, which is a very serious situation. So never ever, without the doctor's order, we should never clamp or even milk. Chest sound should be auscultated every 2 hours. Then chest x-ray is being taken. Spirometry is also advisable. Then during the removal, you have to keep that, okay, Valsilla manure has to be applied, and one of the indication for the removal of the intercostal drainage is the total drainage should be less than 100 to 150 ml per day. Okay, that's all for intercostal drainage. See you again with more videos. Thank you.